Broadcast is now starting. All attendees are in listen-only mode.
Thank you all for joining us for today's webinar. Today our presenter is Dr. Marty Kotler. He will be presenting on how to add acupuncture to a chiropractic office. I'll now turn the time over to you, Dr. Kotler.
Okay, thanks, Melissa. And I want to thank everyone over at ChiroCode for inviting me to do these webinars. I enjoy doing them. I hope everybody enjoys listening to them. So let's get started. Yeah, today's topic is how to add acupuncture to a chiropractic office. A little bit about myself before we get going. Again, my name is Dr. Kotler. I'm a chiropractor. I'm also a certified professional compliance officer. I'm certified in CPT coding. My areas of expertise include Medicare compliance, HIPAA compliance, record keeping, creating compliant cash plans and treatment plans. I've written many documentation and training manuals on chiropractic, physical therapy, and acupuncture, billing and coding. Write articles for many journals and publications nationwide. Write articles for Chiropractic Economics, Dynamic Chiropractic, the American Chiropractor, the American Academy of Professional Coders, and I'm a guest speaker at many state association conventions nationwide. So there's a little bit about myself. Now, there are pros and cons to adding acupuncture to a chiropractic practice. Overall, I think it's a wonderful thing to do. I think it's a nice adjunct to a chiropractic practice. But there are some negatives to it, so I wanted to touch base on the pros and cons of adding acupuncture to a chiropractic practice. To begin with, let's go over the positives. It's a great way to co-treat patients. There were patients in my practice where, I just wasn't getting them as well as I had expected. There were some patients that had conditions that I just didn't feel that I would be able to help. For example, nausea. I didn't feel like my chiropractic adjustments were going to be able to help that. So that's one of the reasons why I brought in an acupuncturist to treat things that I just was not able to treat. It adds another clinical approach. It's nice sharing information. If I had a patient where I just didn't understand, what was happening with them, it was just nice to have another healthcare professional there to share thoughts and ideas. Definitely going to add more services to the practice, and that means you're going to have many more marketing opportunities. You will have patients coming in seeking acupuncture services that if you didn't have it, they would have never come into your office. They weren't looking for chiropractic care. They're looking specifically for acupuncture. And you're going to have patients coming to the office just for acupuncture, and they have no interest in chiropractic. Don't get insulted. It's okay, right? You've heard the statement, the customer's always right. If the patient wants to come in and just get acupuncture and you don't offer it, well, then you've lost business. So having an acupuncturist there, you can offer more services to more people in your community, and you can definitely have wonderful marketing opportunities. Now, some of the negatives. If you have a very, very small office, you might not be able to bring on the acupuncturist. I have quite a few docs I work with. They have tiny offices. I have one chiropractor I work with in New York City. He has 400 square feet. He just doesn't physically have the room. You may need to cover the malpractice costs of the acupuncturist. These are the things you need to be prepared for. You're going to have more overhead if the acupuncturist is going to be an employee. Well, there you go. You're going to have some salaries right off the top. It may add some confusion to staff. See, when I had my chiropractic practice, I was my staff's there. I was their only boss, so to speak. I had multiple staff members. They only had to answer to me. Then I brought on MDs, PTs, massage therapists, acupuncturists, a few of these providers. I made partners in the practice, and now they were telling my staff what to do. Some of my staff members didn't like that. They were just used to me, and now they had other staff members telling them what to do. it was a little confusing. I had some staff members quit when I went from chiro only to multi-specialty. So just be prepared for that. It may be hard to find acupuncturists in your area. I have a couple of clients in Ohio that they've been looking for an acupuncturist for over 2 years. They cannot seem to find one. And if you find one that you really like, and then they quit out of the clear blue sky, and now you have to go find another one to replace that provider, that could be stressful. That can happen too. So there's pros, there's cons, but overall, wonderful thing to do. Now let's talk a little bit about the corporate structure. So the following corporate structure information is for educational purposes. It's not intended to be legal advice. Target coding does not engage in providing legal services. Regardless of the corporate structure you choose, you must contact a healthcare attorney prior to seeing patients. Even if you're an existing integrated practice, we recommend you consult with a healthcare attorney to discuss your present corporate structure. I know some doctors that have been set up by consultants and attorneys many years ago, and times have changed. They haven't kept up with the new rules and regulations and laws, and they're operating their practices incorrectly. So it's a good idea to get an attorney, take a look at your corporate structure. There are 3 options, in my opinion. Employer-employee, meaning chiropractor is the employer, acupuncturist becomes the employee. Next, partnership. You and an acupuncturist may want to co-own a corporation. And then the third possibility is renting space to the acupuncturist. So let's start off with the employer-employee key points. So you as the employer, the chiropractor, you're going to do all the billing under your tax ID number. You're going to receive all the money coming into your practice, and then you're going to pay the acupuncturist a salary, straight salary. You have to pay for taxes. And then you should get an attorney to create an employment agreement, just like if you were hiring an associate chiropractor. And that employment agreement should list the duties, the responsibilities, who's going to pay for the malpractice, non-compete, non-solicitation. Is it okay for the acupuncturist to work part-time in another chiropractic practice? Are you okay with that? Find out if this acupuncturist is presently doing that. Or maybe you don't want the acupuncturist working in another facility. Maybe if you don't address this, you could have an acupuncturist working for you 3 days a week, and 1 or 2 days a week they're working in one of your competitors' offices, maybe stealing your insider secrets, or passing along, maybe not necessarily stealing, but passing along your good forms and your procedures and protocols. Maybe you don't want that. Put that in the agreement. That could be a make or break thing. Tell the acupuncturist, you have to work for me. You're not allowed to work for any other healthcare facility. Or if you want to work for another healthcare facility, it cannot be within 20 miles of my practice. Outline that in the employment agreement. Are you going to offer benefits, vacation time, health insurance? Next, partnership. Maybe you want to go partners with an acupuncturist. So in that case, all the billing will go out under the group tax ID number. All the partners in the practice will receive compensation attributable to the entire practice based on ownership. So let's say you own 70% of the practice and the acupuncturist owns 30%. And now you get a check in the mail from an insurance company for $100. Well, you get 70, the acupuncturist gets 30. Again, check with a lawyer. Make sure it's okay. Check with your accountant. You want to get an attorney to put together a partnership agreement. That should outline contributions to the practice, distributions, taxes, day-to-day management, delineate duties, non-competition, confidentiality. Next, you may want to rent space to an acupuncturist just to kind of test the waters and see how it's working, see how that dynamic, that relationship is going. You could refer to the acupuncturist could refer to you. You have 2 separate practices. You're just a landlord collecting rent. The acupuncturist will do his or her own billing under her own tax ID number. The rent that the acupuncturist pays you should be fair market value. If your rent is $3,000 a month and you're charging the acupuncturist $10,000 a month for 2 days a week, something doesn't seem right there. And here you'd have to have a sublease agreement. Do you want to let the acupuncturist use your computers and your staff and your waiting room? Specifies that. You want to, specify the space, the equipment that's going to be used. This agreement should be at least 1 year in duration. It's set in advance. It's not based on patient referrals or patient volume. Just a little heads up on the Stark Law. Chiropractors may own a practice and they may own a physical therapy center. If you are a chiropractor that owns a chiro and a PT and maybe a medical office, you're the owner. Yes, in some states, chiropractors can own physical therapy centers and medical offices, very state specific, but you cannot refer patients from one facility to another facility for certain designated health services. Otherwise, you're violating Stark. Again, you would need an attorney to make sure you're doing it okay. I speak to doctors all the time. They don't know this. They're not sure. I spoke to a doctor the other day. He owns a chiropractic practice and a physical therapy practice. And he's referring patients over to the PT practice that he also has ownership in for DME. Well, that's on the list, you see. Designated health services, physical therapy, radiology, DME, per-click arrangements. Also, anti-kickback. Careful of this. You don't want to get paid for patients. For example, if a patient, not a patient, let's say an attorney, approaches your acupuncturist and says, hey, every time I refer a patient to your practice for acupuncture, I want you to pay me $300. No good. There are safe harbors. There's a good reference there on the bottom. All right, so now let's get into a brand new patient. So a brand new patient comes into the office for acupuncture. There's forms that the patient needs to fill out. For example, health history form, financial policy form, assignment of benefits, authorization to release information, consent to treat minor, a whole bunch of forms. By the way, assignment of benefits, just a little heads up. If you're a cash practice, don't have the patient sign assignment of benefits. You don't want the checks coming to you, right? That's where some doctors, they go, well, I'm a cash practice, but they're accepting assignment. You're not a cash practice. Just because you're out of network and you're telling the patients that you're not participating with their plan doesn't make you a cash practice if you're accepting assignment from their insurance. So careful with that. So have good forms. There's some sample forms. Have good quality intake forms. Here's a sample acupuncture form. Ask certain questions. Here's a sample acupuncture informed consent. This is for malpractice. Make sure you check with your malpractice company. HIPAA notice. Make sure you get your acupuncture patient signing off on your HIPAA notice forms. This is a good quality HIPAA notice. Make sure your HIPAA notice is up to date. If anybody wants a copy of our HIPAA notice, send an email to amy@targetcoding.com, amy@targetcoding.com. She'll send you our HIPAA notice. At the bottom of the HIPAA notice, there's an effective date. If the effective date of your HIPAA notice is prior to September 2013, you're using an old, outdated one. Make sure you read your HIPAA notice. I was working with a doctor recently. Part of our Gold member services, we do a complete forms review with our Gold members. So the doctor sent me his HIPAA form. I guess the doctor didn't read it. Staff didn't read it. I read it. The doctor's HIPAA form had all this dental information in it. I called the doctor. I said, what is this? Where'd you get this? He says, oh, wow. My brother-in-law is a dentist. I just took his HIPAA form. See? No good. Read your forms. Make sure you know what's in it. There are certain things that have to be in there. For example, at the bottom of our form, a lot of chiropractors use open therapy rooms. Physical therapists use open therapy rooms. Add a little item there at the bottom. It says, we utilize an open therapy room. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room. Have the patient sign off on it. Next, New patient evaluation and management code. So acupuncturists are allowed to do E&M services. They have to do evaluations before they do acupuncture, and many health plans will pay acupuncturists for E&M codes. So you should be familiar with these codes. There are 5 new patient codes. These are the same codes medical doctors use and chiropractors use, so now acupuncturists can use these codes. Here's 99203. It's the most commonly billed new patient code. That means you need to do a detailed history, detailed exam, decision making of low complexity. So there are some key points when it comes to exams regarding acupuncture. So E&M services may be reported in addition to acupuncture services. Now, if the patient's condition requires a significant, separately identifiable service above and beyond the usual pre-service associated with the acupuncturist service, then you could bill a re-exam. The time of the EM service is not included in the time of the acupuncture service. Next, your acupuncturist should put together a plan of care. History, exam, diagnostics are the basics. History, exam, diagnosis. So the history, this is where your acupuncturist is chatting with the patient, gathering information. If you're going to be billing for this service, there are 4 levels according to the E&M guidelines. Problem focused is a 99201, expanded 202, detailed 203, comprehensive 204, and 205. So what does this include? A chief complaint. So jot down, Mrs. Jones is coming in complaining of neck pain and headaches. There's your chief complaint. A detailed exam also requires HPI, or history of present illness. You need 4 of those. So Mrs. Jones says her neck pain started many months ago. The neck pain is dull, throbbing, achy. Headaches just started a few weeks ago. Those are all examples of HPIs. How did it start? When did it start? Is it dull? Is it throbbing? Is it achy? Is it burning? Pain scale. Those are your HPIs. And then you also have to do a system review. Have your acupuncturist do a thorough system review. You need 2 to 9 systems to be reviewed for 99203, and then you need 1 item from the past family social history. For our clients that don't have software, we created a review of systems form. You should see it on your screen now. You need to review 2 to 9 systems and 1 item from the past family social history. Next, your acupuncturist needs to do an exam. Again, exam requires 4 choices here: problem focused, expanded problem focused, detailed, comprehensive. So a detailed exam, if your acupuncturist is going to bill for 99203, you need 12 examination findings. So those can be by palpating the joints. So Mrs. Jones has neck pain and headache, so palpating the neck, looking for joint instability in the neck and head, range of motion in the neck. See if there's any muscle spasm, muscle weakness, muscle tightness, hypertonicity in the neck muscles and upper back muscles. And your acupuncturist is probably going to want to look at the pulse, if it's rapid, slow, thin, scattered, hollow. Many acupuncturists look at the tongue for its shape, its coating, its color. Many acupuncturists like to do vital signs, look at the ear. Next, the diagnosis. Probably keep it pretty simple with acupuncture and use pain codes. But some health plans consider acupuncture medically necessary for other things like nausea, dental pain, osteoarthritis of the knee and hip, migraine headaches, TMJ disorders. Here's some ICD-10 codes here for pain and headaches. You have intractable and non-intractable. Intractable means the patient is just not responding to conventional care. Make sure you pick the right headache codes. Aura, without aura. With status migrainosus or without status migrainosus. Make sure your acupuncturist is choosing the right diagnosis codes. Dizziness, sleep disturbance. There's nausea. tinnitus, ringing in the ears. I think it's a good idea if a patient is coming in to see the acupuncturist for headaches, have the patient fill out a headache disability index. Good way to monitor progress, good way to document what's happening with the patient. For example, my headaches make me angry. Yes, sometimes no. Because of my headaches, I am less likely to socialize. Yes, no, sometimes. Have the patient fill this out. Do 3, 4, 5, 6 acupuncture treatments. Have them fill out again. You'll see tremendous results. Now we have the acupuncture CPT codes. Here's the first one, 97810. Acupuncture, 1 or more needles, without electrical stim, initial 15 minutes of personal one-on-one contact. 97811. Acupuncture, 1 or more needles, without electrical stim, additional 15 minutes of one-on-one contact with reinsertion of the needles. Next, 97813. Acupuncture, 1 or more needles with electrical stim, initial 15 minutes of personal one-on-one contact. 97814, with electrical stim, each additional 15 minutes with reinsertion of needles. So, acupuncture is based on these 15-minute increments of personal face-to-face contact with the patient, not the duration of the acupuncture treatment. Only one code may be reported for each 15-minute increment. So you're going to use 97810 or 13 for the initial 15 minutes, and only one initial code is reported per day. Codes 97811 and 14 indicate additional 15 minutes of personal one-on-one contact with reinsertion of the needles. Now, this reinsertion is based on clean needle technique. It would not indicate removing and reinserting the same needles, but an additional insertion of new needles. So this 15-minute increment, it's not like the time-based code, 8 to 22 minutes, 1 unit for the therapies. This 15-minute increment is defined as personal one-on-one contact with the patient. This means the acupuncturist is in the room with the patient, actively performing a medically necessary activity. That's part of the acupuncture service. Now, the acupuncture time increments of one-on-one contact with the patient can include many things like counseling and coordinating care, patient chart review, discussing with the patient the results of the last treatment, selecting and palpating the appropriate acupuncture points, inserting the needles, manipulating the needles, removing the needles, reinsertion of the needles, disposing of the needles. So that's a quick crash course in the acupuncture codes. Now, acupuncturists can also do modalities in most states, and some insurance companies will pay. Hot packs, cold packs, traction. Make sure you're giving the clinical rationale. If you're going to do traction, the reason why you're doing it to promote distraction and joint hydration, electrical stim. You have 97014, and the HCPCS code is G0283. And you also have vasopneumatic, paraffin, whirlpool, diathermy, infrared. Acupuncturists like to use diathermy and infrared. There's attended stim, 97032. These are one-on-one time-based codes. Ultrasound is another one. Laser, you might have your acupuncturist doing laser, 97039, which is an unlisted modality because there's no CPT code for laser. And then you have the HCPCS code of S8948. Acupuncturists oftentimes provide therapeutic procedures. Acupuncturists with many health plans will get paid for therapeutic exercises. Now remember, therapeutic exercises is used to develop strength, endurance, range of motion, flexibility. It has to be an active procedure. That means the patient is performing the service with skilled assistance by the acupuncturist. So these are the typical active procedures for 97110, tubes, balls, bands, weights. If you're not familiar with low-tech rehab, go ahead and contact Foot Levelers. They sell the Baxis and the Nexus. It's one of the easiest ways to get your rehab going. The Nexus, you just attach it to a wall or a door, and you could have the patient doing isometric neck exercises within 5 minutes. You could be up and running. You could have the patient doing abdominal crunches and floor exercises. These are all active procedures. This is passive, like manual therapy or massage, or passive modalities. Acupuncturists might be able to get paid for massage. I know many acupuncturists like to use Tuina, which you can use as a Chinese form of manipulation or manual therapy. 97140 is soft tissue mobilization, manipulation, myofascial release. If the acupuncturist is billing for the therapy codes, the time-based codes, make sure you understand what constitutes 1 unit. 8 to 22 minutes is 1 unit. 23 to 37 is 2 units. But be careful if you're billing, let's say, United Healthcare for acupuncture time-based codes. If you do 23 minutes of 140 and then 23 minutes of 110, don't bill 4 units. That totals 46 minutes. You can only bill 3 units. Acupuncture soap notes. Similar to chiropractic soap notes, SOAP, patient comes in complaining of pain. You could use pain scales. You could use a VNRS or a VAS. Symptom frequency, meaning, patient says that she feels her headaches 60% of the day. That equals frequent as far as frequency, symptom frequency. Objective findings, sure, your acupuncturist is going to find some muscle problems, muscle spasm, poor posture, forward head translation. Assessment, is the patient meeting the goal? How is the patient doing overall? Better, same, worse? In the P portion, what did you do? Well, we did acupuncture with electrical stim, initial 15 minutes applied to the following lumbar acupuncture points. We did acupuncture with electrical stim for additional 15 minutes with reinsertion of the needles applied to the following head and cervical acupuncture points. Manual therapy, myofascial release with direct hands-on, one-on-one contact to the lumbar and occipital cervical regions, 30 minutes. Infrared to the lumbar and occipital cervical region to reduce pain and inflammation, 10 minutes. So these are just some examples of the soap notes that you should have. Patient should be on complete bed rest, apply ice, tolerated the treatment well. Now, there's a difference between acupuncture wellness care and medically necessary care. Medically necessary care means insurance payable. Wellness care is not insurance payable. The patient has pain, restricted motion, decreased activities of daily living. That's payable. Very little pain, range of motion is great. Patients do most of their ADLs. That's not insurance payable. Insurance might not pay for everything that your acupuncturist does. If it's not medically necessary, it's not insurance payable, but it could be clinically indicated and just get the patient to pay cash. So what is medical necessity? Depends who you ask. If you ask me, everything's medically necessary, but ask Aetna. If you have Aetna patients coming in for acupuncture, Aetna pays for acupuncture. Aetna considers acupuncture medically necessary. If the patient has neck pain, headache, nausea from pregnancy, so they list what they will cover. They list things that they would not cover. Aetna will not pay acupuncturists for menstrual cramps or AIDS or cerebral palsy or Parkinson's. They give you the list. They provide the documentation requirements for acupuncture, and they give you the diagnosis codes. They're the migraine headache codes and the osteoarthritis, TMJ disorder. Next, have your acupuncturist do reevaluations. I don't know, 3 to 6 visits, somewhere in there. That's what I typically see. Acupuncturist reevaluating. And you could do the established patient E&M codes 99211 through 215. At least 2 out of the 3 key components are required. And an established patient is one that has received services from you within the past 3 years. Here's a little chart. 99213, that's the most commonly billed re-exam code, not only by Acu, but Chiro and MD. Requires a chief complaint, 1 HPI, 1 ROS, and 6 to 11 exam findings. So insurance that pays for acupuncture pays very well. That's been my analysis. The insurance companies that pay for acupuncture pay pretty well. Actually, more than they pay the average chiropractor. So it's a nice service to provide. Think about it. Now, if you bring on an acupuncturist and you're not doing things the way you're supposed to be doing it, and you rush into it, and you don't vet, and you're not documenting properly, but you're getting paid, it can turn into a problem. It happened to an acupuncturist I'm working with right now. This acupuncturist was billing an insurance company for a few years for acupuncture, got audited, and recently received a request for a refund. It says the medical records were requested and a comprehensive review was performed, and our audit result identifies damages in the amount of $746,000. This insurance company wants $746,000 back from this acupuncturist. Not a good letter to get. So make sure you're doing things right. Bill compliantly, document compliantly, put together a billing and coding policy manual. That's what I would recommend. Have an acupuncture billing and coding policy and procedure manual. This includes having formal staff trainings. It includes written policies and procedures, conducting staff trainings, looking at your records, do an internal review of your records. I don't know if you've ever done that, and you might not even be doing it for your chiropractic records. You should. If you're billing Medicare, it's mandatory that you do a chart review. We put together an acupuncture chart review tool. We have sample training logs. So if you want to get a acupuncture or chiropractic billing and coding compliance manual from us, let us know. Take action steps to prevent problems. Read the policies from all the plans you bill. Attend seminars, webinars. Our compliance manual includes policies and procedures, HIPAA notice forms, training logs. We do them for physical therapists. We do them for acupuncturists, chiropractors, Medicare, non-Medicare. And the purpose of compliance, so you have Medicare compliance, HIPAA compliance. The purpose of Medicare and billing compliance is to prevent billing and coding errors. The purpose of HIPAA is to protect patient health information. So HIPAA's been around a while. HIPAA applies to all covered entities. Is your acupuncturist considered a covered entity? Let me ask you 2 questions. Is your acupuncturist a covered entity? Question 1, is your acupuncturist going to be billing insurance and receiving payment from insurance? Well, then your acupuncturist is considered a covered entity. Is your acupuncturist going to be submitting claims electronically? If yes, covered entity, which means you have to abide by all the HIPAA rules and regulations. I get these questions all the time. Can you have sign-in sheets? Yes, but just the patient's name, not the reason why they're coming in. You don't want to have on your sign-in sheet, Harry, headaches, Barry, bursitis. No, just the name. It's okay. You could have a waiting room full of people, and your front desk receptionist can say, Jill, come on in, you're next. It's okay if everybody hears. You don't have to use a last name if you don't want to. Keep your computer screens away from public view. Emails, careful with emails. Change your passwords. This is all important for your acupuncturist to know. Your acupuncturist needs to have a backup of all the files. antivirus software, firewalls? Is your acupuncturist going to be putting your patients on the acupuncturist's laptop? Is the acupuncturist going to be taking the laptop home with him or her? Who owns that laptop? Is it encrypted? So these are the things that you should think about when you bring on an acupuncturist. You're going to fire the acupuncturist? Well, you should have, it's mandatory that you have a termination policy. And here's a great link if you want to start doing HIPAA on your own. ChiroCode has an excellent HIPAA book that you could buy if you want to do it on your own. Here's a website you can go to and start putting together a HIPAA program on your own. HIPAA requires that you do a security risk analysis, or also known as a security risk assessment. So here's a good tool that you can go and download and do it yourself. All right, just a few closing comments. Please check with all the carriers you bill prior to submitting claims based on this information. We can't guarantee this is going to guarantee payment from any insurance company or patient. Just a side note here, Target Coding offers many services to chiropractors and physical therapists and acupuncturists and massage therapists nationwide. We do seminars, webinars, obviously. We have training videos. We have an acupuncture billing and coding training video. We have an acupuncture compliance manual. We offer on-site consulting, membership programs, hourly consulting. We have sample acupuncture forms and soap notes, and we offer HIPAA compliance and Medicare compliance programs. All right, so here's our contact information: email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. Please go ahead and check us out on Facebook. Like us on Facebook, follow us on Instagram and Twitter. You could view our free webinars on YouTube. So go ahead and go on Facebook, Twitter, YouTube, Instagram, search Target Coding or my name, Dr. Marty Kotler, and check us out, and we send you gifts and tidbits of information. All right, Melissa, I'm ready for questions if you are.
Okay, we have a question from Deborah. She is asking if you can show the acupuncture CPT codes needed for non-electrical.
Oh, sure, I could bring that up on the screen. Did she have a follow-up question, or that was it?
Yeah, I think that was just it. She just wants to see those codes again.
Yes, 97810 and 97811. Those are the two acupuncture codes without electrical stim.
Okay. And then our next question is from Jennifer. She's asking if you have any advice on how to attract an acupuncturist to your office.
Yes, I would contact local acupuncture offices and just say, hey, my name is Dr. Kotler. I'm a chiropractor, and I am going to be integrating my practice, adding acupuncture. Are you interested in working in my practice? That's one way. Ask your patients if they know acupuncturists. Of course, you could put an ad in the paper. Heck, I have some clients that have gotten their acupuncturists on Craigslist. You can go to Indeed.com. There are companies that placement agencies. So, yeah, there's many ways to find acupuncturists.
Okay, and we have another question from Atilia. It says, any advice for the chiropractor who also does acupuncture?
Any advice? Yeah, treat as many people as possible and get busy, and get so busy that you have to hire additional acupuncturists, and then open up 500 acupuncture offices across the country, and then retire in the Bahamas.
Sounds like a good plan to me. Okay, we have another question from John. He asks, do dry needles use ACU codes or unlisted modality?
Dry needling, well, it depends who's paying the bill. Dry needling is not covered by any insurance, as far as I know. So it's a cash service. So dry needling is not acupuncture. So Dry needling make sure that it's allowed. For example, in New Jersey, just recently, dry needling got taken out of the physical therapy scope of practice. So be careful with dry needling. Contact your state board. Depends who's doing it. But I could tell you, most insurance companies do not cover dry needling, so it should be considered a cash service as long as it's covered under your scope of practice.
Okay, and Christopher is asking, is it legal for an insurance company to allow for acupuncture performed by an MD, but not by a licensed acupuncturist?
The insurance company, if that's the insurance company's rule, I don't know if it's illegal. Doesn't sound right to me, but the insurance company makes the ruling. So if they say it's only covered if an MD does it, yeah. And every state is different. Like, for example, in the state of Florida, a chiropractor that's already licensed as a chiropractor only needs to take a 100-hour course and then can do acupuncture and get paid for acupuncture by insurance. Other states, chiropractors cannot do that. In some states, chiropractors can employ acupuncturists. In some states, like New York, chiropractors cannot employ acupuncturists. So many different rules on who can do it. Got to check your scope and check with the insurance companies.
Okay, and our last question is, do all insurance companies cover these codes, or would you need prior authorization?
You have to check with every plan before you bill to confirm coverage. Yeah, some do and some don't.
Okay, perfect. Well, we'd like to thank you for your presentation today, Dr. Kotler.
Thank you for having me.
Yeah, and then to let all of you guys know that this webinar will be available for the next 30 days on our website. After that, webinars are made available in ChiroCode's premium membership. You can also check out ChiroCode's webinar page for future webinars. Thank you again for joining us, and have a great day.